Hair restoration procedures are becoming more popular than ever, but there's a black market of unlicensed clinics offering bargain procedures. Sounds like a bargain, but it could lead to some serious medical complications. Dr. Brett Bolton is the founder of Bolton Hair Restoration. He's a specialist in advanced follicular unit extraction, also known as FUE or FU. Welcome, Dr. Bolton. I know it's FUE, not FU, because I've done it. I didn't have hair implants, but I've done the PRP treatments. I know exactly where you are because I live half the time on Galt Ocean Mile, right down by you, by Lauderdale by the sea, Fort Lauderdale border. So I know exactly where your clinic is. And but this is it was much thinner. This is from 5 treatments of PRP. Got that back. So I'm a big proponent of what you do, but you need a professional to do it, right?
Absolutely. Thank you, by the way, for having me. Yes, definitely. What we're seeing right now has changed the industry. And you said I'm a follicular unit specialist, and I just have to make a little bit of a correction on that. I've been doing hair transplants now for about 30 years. And I've actually never done the follicular unit extraction procedure because, in my opinion, it's not the best method to get the donor. And when you talk about the black markets, what we're finding is the people that are offering the follicular unit extractions, a lot of times they're medical practices that aren't concentrated on hair transplants. So what they're doing is they're bringing in teams from across the country, and these are medical assistants not licensed in the state, and they're doing the follicular unit extractions. This is the method in which they're harvesting the donor. So they're individually poking the holes out of the back of the head to get the follicular units out. However, the people that are doing it in most cases are unlicensed and are not allowed to do it in the states that they're doing it in.
That's awful. And so that could leave scarring on the back of the head, right, where they're taking the units out. And then when they go to implant them, you could get infections. It'll leave that doll head look. It's awful. So this is why you need a professional to do it. What methods do you usually use to help with hair restoration? Do you start conservatively and work your way up when you deal with folks?
Absolutely. The first thing we always do at my practice is the first thing we want to do is get the patient stabilized, meaning we want to make sure that their genetic hair loss is under control. And we can do that with 2 FDA approved preventative treatments. Those are, I'm sure you know the names, Rogaine and Pisha. Those are the brand name. The ingredients are minoxidil and finasteride. The method I use for extraction is the strip procedure, which is known in the industry as what's called an FUT, a follicular unit transplant. We learned from what you said, the doll's hair, the older style where they were doing the punch biopsy, better known as the plugs. Picture a pencil hollowed out with a razor blade, let's say, where they punched holes in the back of the head. They'd punch that bundle out, might have 15, 25 hairs back in those days, punch a hole out in the top, take that big chunk of hair and then plug it in. Well, they had to space it out so much to make sure it had enough blood supply, and then you'd have unnatural growth of grafts. They looked unusual because of the spacing. But then the technology advanced, and we started to do what are called one-hair grafts, which is a one single hair at a time. And then we do, instead of those bigger plugs, we do something that's called a follicular unit. These are naturally occurring bundles of hair we all have in the back of our heads. They come in little groupings. You could have a 1-hair follicular unit. You could have a 2-hair follicular unit, 3, rarely a 4. So the industry went from those big grafts to now these smaller ones. Well, what happened was, because this strip technology was getting so much hair, some of these older time doctors wanted to increase their revenue. So they came up with this follicular extraction method, really to get more patients to have more surgeries. That's the bottom line. We already learned it was a failed method to extract the donor because it caused more scar tissue, more problems with disrupting the blood supply, more problems with disrupting the nerve supply, versus taking a linear strip. So what's happened is, because it's being done by technicians, you can go overseas to, let's say, Turkey, where you can get it done extremely cheap. So it's very enticing for patients. They see on social media this influencer. Oh, I went to Turkey. I picked up in a limo, put in this great hotel. I got this surgery. My question is who's doing your surgery? Who's
Mhm.
extracting that donor? What recourse do you have in the event you do get an infection? What are you going to do when you're in Turkey? So this is what's happening in the industry, and it's widespread throughout the country where non-physicians are performing medical procedures, which, as far as I'm aware, is against the law in mostly every state.
Yeah. I mean, Doc, I've seen Dominican Republic, Mexico, I've seen Costa Rica, all these, not only hair, but other medical procedures, if you will. And again, do you want to be the guy on the plane with your literally your scalp oozing with infection as you make your way in pain back to the United States, a few $1,000s poorer, and now you got to go to another doctor to hopefully repair the damage done there when you could do it right with a doctor you could go back to if you have a problem in an emergency. Just and for what it's worth, my procedure started with finasteride, which definitely helped. Rogaine didn't help for me. Finasteride worked great. Bosley or Nioxin, one of those shampoos to help minimize the stuff at the follicle level, and PRP. And for what it's worth, that's what worked for me. And I've been happy as a clam since, and it's stopped the hair loss on my hair as thick as could be. But I was going to go your next route if necessary, so I know who to call if I need. But definitely, you want to talk to a good, reputable doctor like this. And I know you do a lot of repair of the damage, but we're going to do a whole other show on that in the future. What's a website for people to contact you in case they need you, especially for repair, but if they just want a good doc who could take care of this correctly from the start?
Thank you very much. Dr. Brett Bolton at greathairtransplants.com.
Very good, Dr. Bolton. And by the way, I appreciate the fact that you look beautifully put together yourself. I've seen a lot of doctors who do what you do, and I look at their hair and I'm like, go to one of your friends and take care of it. You look perfect. So God bless you for that. Founder
Thank
of Bolton Hair Restoration, Dr. Brett Bolton. Thank you for coming on this morning.
you for having me.